Why do we want to have a CPG on the gambling disorders? Basically three reasons, right? We want to raise awareness amongst the medical fraternity, amongst the medical professionals to be able to detect and know that there's such a disorders, right? To look up for them. So it provide you with a guidelines to screen and also to detect. Early detection is very important, right? Early treatment is better than later on, and also a guideline for the professionals, psychiatrists, addiction counselors to assess and treat the people, the gamblers. Okay, so so that this 100,000 people out there, right, living out there in the community and the families can be helped, can be saved. Okay. So thank you. I'm going to invite Hwee up here to give you a talk on understanding of the gambling disorder. Okay.
Good afternoon, everyone. Fellow colleagues, I'm Hwee. I'm from the Resilience Mind Clinic. As Dr. Lee mentioned previously, I was with the National Addiction Management Service at IMH. So I know Saturday is precious for everyone, so I'm going to keep it to the main point, okay? I'm just going to give an overview of what is gambling disorders, okay, before Dr. Lee continue to talk about how to screen for it. Okay. So I guess we take one step back. Just now Dr. Lee said that, you can bet on many things. You can bet on the two flies on the wall. You can bet on who's going to be the president. Okay. So what is actually gambling? So if we look at let's say we look at the dictionary. Okay. For example, Webster Dictionary, it says it's to bet on an uncertain outcome, to take a chance. Okay. Cambridge Dictionary say that it's to do something risky, that might actually result in loss of money, but actually is with the hope of getting more money. Dr. Potenza is a renowned researcher in gambling. He said that it's to place something of value at risk in the hope of achieving something of greater value. Okay, so to summarize, it's actually a game of chance. Okay. Usually, the word chance is very important. Usually, we spend a long time trying to convince our gambler that what you're betting on is chance. You have no control over it. But most of the time, my gambler will actually argue with me and say, no, I can control it. No, I know the probability. I can do certain thing to increase my chance of control if I do certain thing. I've learned about it. Okay. Another main point is there's money involved or some material of importance. Okay. So to summarize, we'll say that gambling is involve wagering of money or something of material value on an event with an uncertain outcome. Okay, we don't know where it will go. Okay, with primary intent of winning additional money. Okay, the bet is irreversible once placed. Outcome of the wager is typically evident within a short period of time. That's why casino gambling is so thrilling, so exciting for them. Okay. And outcome, again, as I emphasized, it relies on chance. Outcome is an unpredictable random event of which one has no control. Okay. Okay. So the types of gambling, usually we classify it according mainly casino and non-casino gambling. Okay. So casino gambling are things like table games, most commonly baccarat. A lot of people like it. Electronic games like jackpot, slot machines, and other games such as bingo. But of course, being casino game doesn't mean that they actually have to go to the two casino to gamble. They can do it at a cruise ship. They can do it online. And I've been told by my gamblers there's a lot of illegal gambling den, especially at Geylang. Okay, so some of them might not go to the two casino, but they're still involved in all these games. Non-casino gambling, we're talking about mainly lottery like 4D, Toto. Some people play cards games, poker, bridge, and I'm quite surprised that recently I'm seeing more and more young adults who are involved in poker games, and they try to be professional gambler. They feel that they can actually earn money, like a career from this poker game. Sports betting, as Dr. Lee mentioned, is one of the most common activity of gambling that we see among our treatment-seeking gamblers. Soccer betting, horse betting, and of course the good old mahjong. Okay, so why do we want to differentiate what sort of game they play? Okay, because it sometimes it gives us some clues about what is the underlying reason for them to gamble. For example, someone who play jackpot, you might think that are they a escape gambler because they just spend a lot of time in front of the machine, maybe they're just bored, just trying to occupy the time. Whereas someone who play the baccarat, are someone who are more thrill seeking, going for the excitement. Okay, so gambling behavior, it comes in a continuum. We can't say that if you gamble, then it's wrong. After all, it's not illegal activities, right? Just like Dr. Lee said, there was one of his colleague, I know who is it as well, who play mahjong all night, but he's not a problematic gambler. So we look at the behavior, it comes in a continuum. On one end, you can have someone who never gamble. Most of the time, you have people who gamble socially. Then we have the problem gambler and pathological gambler. Okay. So what does all this mean? Okay. So if you look at the gambling literature, you'll come across a lot of different terms to describe gambling problems. The common one are things like at-risk gambling, excessive gambling, compulsive gambling, dysfunctional gambling, problem gambling, and pathological gambling. Okay. In coming up with this CPG, we actually use literature that actually talk about problem gambling and pathological gambling because these are terms that are well defined. Okay, because excessive gambling can mean different things to different people. Okay, so all the literature that we use in this CPG actually use this term, and together we call it gambling disorder. So I'll explain what is problem gambling and pathological gambling. Okay, first, social gambling. Most of my gambler, when they come to see us, they will say that they'll try to argue that they're actually social gambler. But what is a social gambler? It's very similar to social drinking. We're all more familiar with treating those people with alcohol, right? Who are those with problem. So social gambling is just like social drinking. You gamble for fun, relaxation, leisure, and you're able to set a monetary limit. And you don't bet more than what you can afford to lose, okay? And losing is part of the game. You win, good. You lose, never mind, okay? And it doesn't cause problem at home, work, or doesn't cause problem to their social life, okay? So the important thing is it doesn't gamble more than what he can afford to lose, okay? So sometimes, a lot of time people ask us, how much you have to gamble for you to qualify as a gambling addict, okay? We say that actually it's not the amount of money, it's what you can afford. A big director, Tauke, maybe can afford a Ferrari, okay? But for a low income worker, maybe even a few $100 is too much for them, okay? Okay, so what is problem gambling? Again, this is very similar to, if you use a concept of alcohol abuse or drug abuse. This is when someone bets more than what he can afford to lose. So the gambling starting to interfere with the personal life, maybe the studies, the work, even affect the family. So basically, the gambling behavior have caused problem or negative consequences. But it actually fall below the diagnostic threshold of pathological gambling if we look at the DSM-4, which I will explain further. Most of the time, they meet about 3 to 4 diagnostic criteria. Okay, so it doesn't fulfill the diagnosis, but we know that these are people who are actually having a lot of problem with gambling and should not be ignored, and maybe they are on their way to become a pathological gambler. Sometimes what happens is when we first see them, we can only classify them as problem gambler because they don't fulfill the diagnostic criteria. But sometimes it's because they don't tell us the whole picture. If we see them for a few more sessions, sometimes then we get more history. Okay. So pathological gambling, this is the most severe form of excessive gambling behavior. This is when someone loses control of his gambling. Okay, they have great difficulty stopping gambling. A lot of time they know that they're in problem, that they just cannot stop.